Hello everyone, welcome back in another session of dental license exams. Today we will cover Saudi dental license exam SDLE to practice dentistry in Saudi Arabia. This exam is conducted by Saudi Commission for Health Specialties. In this video we will cover eligibility of this exam, like what condition must met to appear in this examination, what is its fee, its pattern of questions, and what subjects you need to study. Apart from that, we will discuss about when you get your results and what's passing criteria. So let's move from eligibility. Of course, we all know that we must have 4-year BDS degree from an accredited institution. All Pakistani, Bangladeshi and Indian institutions are accredited, so no worries about that. Another thing it is that you must have covered your 1-year house job, which is also called internship in some areas. You must have done that. Apart from that, there is a crucial thing: 1-year experience, clinical experience after your house job, if you want to practice privately in Saudi Arabia. But if you want to practice in government institutions like in any hospital of Saudi Arabia, which are usually actually called as sponsored jobs, you must have 5 years clinical experience. Without 5 years clinical experience, you are unable to get job in government institutions in Saudi Arabia. So think carefully, that many people think that only 1-year clinical experience is needed in Saudi Arabia and fails to secure the seat in SDLE examinations as well. So it is recommended that at least 1 to 2 years clinical experience must you have, because for SDL exam they usually don't give you seats, because nowadays many people are heading towards these examinations and they conduct exams within your own country, so seats are likely to get filled as early as possible, and those who have more clinical experience, they are likely to get the seats. Now, what's the exam fee? It's actually 3385 for general dental surgeons, means 3385 Saudi riyals actually, and 3785 for dental specialists, means whoever are specialists. So what's the exam pattern actually? All MCQs would be clinical based, means there would be no MCQs in normally from, like we can say, pharmacology, general pathology. These were not, because you have to appear in clinical exam, and all would be dental related. These would be 200 in number, and each MCQs carry 4 marks. So in total 800 marks paper examination will be. It will be conducted into 2 parts, means in 2 sets, and between 2 sets there will be a 30 minutes break, and for each set you have 2 hours, and in 2 hours you have to attempt 100 MCQs. So in total 200 MCQs would be distributed in 4 hours, and 30 minutes break inclusion, it would make 4 hours and 30 minutes the whole test time. Then what subjects you must need to study? There are different subjects and people used to say differently, but I will guide you accurately. These subjects related to dentistry, means these are your 3rd year and final year subjects. These are all clinical based: periodontology, oral medicine, oral pathology, of course, then oral surgery, orthodontics, conservative dentistry, endodontics, pedodontics, and prosthodontics. These are all the subjects. Most important part of all the subjects are restorative dentistry. You must have done this thing, means in restorative dentistry, conservative dentistry, endodontics, and pedodontics are all its parts. So huge percentage is occupied by restorative dentistry. And what's the result actually? It usually takes 1 to 1.5 months, and sometimes it may come in 14 to 20 days as well. And there is no negative marking. Many people used to ask me that is there any negative marking in Saudi dental exam, because there is a misconception and people spread this rumor that there is a negative marking in examination, but there is actually no negative marking. You can get 4 marks if you are going to do the correct answer, and if your answer is wrong, no worries, your 4 marks will be only cut. So overall passing percentage would be 542 out of 800. Remember, if you need to make any documentation for Saudi dental license exam, you can consult me as well, and if you have further any questions regarding this exam, you can ask me. I hope I have cleared everything all. Thank you so much. Have a nice day. Bye bye.